And welcome back to Ask the Doctor. I'm Mike Berger, here to answer your medical questions on pain management. Today is Dr. Robert Bolger. Just call the number that you see on the screen. It's 1-888-572-4411, or visit the website at www.southwestpaingroup.com. Now, Dr. Bolger, we've talked about ultrasound. We've had the demonstration. Can you tell us if there's something else ultrasound can be used for besides maybe joints, or is there something fascinating you found about it that works for you?
Yes. Well, the thing about ultrasound that's so interesting is that it's used not only for treatment, to direct treatment, but it can be used for diagnosis. And radiologists, of course, have used ultrasound for years for that. As an example, I recently went to a meeting, ultrasound meeting, and I've had some trouble with my wrist, carpal tunnel type symptoms. And the director of the program was a radiologist, and he showed me how to use ultrasound to diagnose carpal tunnel syndrome. And as it turns out, I think I probably have it. So that was very useful. Another really very useful thing with ultrasound is piriformis injury or sports injuries. A lot of people get pulls and muscle strains, and you can actually see these muscular injuries with the ultrasound device. So it's a really burgeoning area for pain doctors, because in the past we've had to rely on MRIs, which are expensive, and of course physical exams, very important, can't be underlooked, and patient complaints, but using ultrasound as an adjunct in the pain doctor's office, in essence, moving this out of the radiology suite and into our offices is an exciting thing for us.
Well, I would imagine, especially with athletes, the quicker you can get to them if they've had an injury, the quicker you can diagnose, the better off they're going to be, and the easier it's going to be for you to treat them.
As a matter of fact, more and more professional sports teams are now have ultrasound machines in their facilities to help more quickly diagnose, tears, sprains.
So the doctors are right there, they
Absolutely.
Can hook it up and they're ready to go.
Yeah.
We have a question now from Ellen in Arlington. Ellen, go ahead.
I have a question about rheumatoid arthritis and fibromyalgia. Is there anything natural or homeopathic that you can use to treat that instead of regular pain medication? My name is Ellen, Fort Worth.
Thanks, Ellen.
Well, Ellen, that's a great question, and it's an area of particular interest of mine because we talked about fibromyalgia before, and we understand it's kind of a symptom complex. Many people think that it may be related to rheumatoid disease. So the fact that she asked about rheumatoid arthritis is very appropriate. Rheumatologists focus on this, and we do too. And because in a lot of ways, what rheumatologists and pain doctors do is very similar. My particular interest in fibromyalgia is trying to focus on treating the symptom of the muscular pain. Now, we don't know what causes it. We've already mentioned that.
Sure.
But we can try to improve muscle function. So I put a lot of my patients on a special program that involves calcium and magnesium. For example, magnesium, for Ellen, is a very, very useful thing. Many women don't get enough magnesium in their diets. If they're menstruating, they lose magnesium. The vitamins, magnesium, there's a number of antioxidants. Our old friend fish oil is very, very useful.
I know you're very high on fish oil.
I'll tell you, the rheumatologists tell us, and we found in our practice, that fish oil really does reduce the inflammation. There's a lot of chronic aches and inflammation related to both rheumatoid arthritis and fibro. So, and finally, Ellen, I have a lot of interest in hormonal therapy. More and more doctors are using testosterone, progesterone, growth hormone, which is in the news with Roger Clemens and things like that. We understand that hormone has some benefits. It also is a very healing hormone, and there are actually clinics and physicians that are using growth hormone to treat fibromyalgia. I have not yet done that, but I have a lot of interest in it, and I do believe there's the customization of the therapy to meet the symptoms is very exciting to me.
Sounds pretty fascinating. We've
very,
covered a lot of fibromyalgia today.
It's a very interesting topic. It's challenging, but there's a lot of people working on it.
We have one more question from the website. Chrissy in Arlington says that she has arthritis pain and inflammation from the knee up to the thigh. Is there anything she can do about that?
Well, the first thing we got to make sure is, Chrissy, what's your diagnosis? Because we want to make sure, is it acute injury? Is it something chronic? I'm not sure that, from the question, I can't
we don't
tell
know
that.
Yeah.
But you need to make sure it's not an injury, or there's something that's surgically correctable. Maybe it's something's torn, but if it's a chronic arthritis condition, then again, going from our conservative friends, which would be things like fish oil, anti-inflammatories, all the way to powerful arthritis altering medications, there's a wide spectrum. The answer is yes, we can help you in a lot of ways. I would use an ultrasound machine to help look at her knee.
I was going to say it'd be a perfect time to use
It would be
your
a perfect time
ultrasound.
to.
Sure.
Absolutely.
We're going to be right back from the Southwestern Pain Management after this break, so stay with us. A lot more ahead.